You're dragging through another Friday, feeling more exhausted than usual. That fatigue has been hanging on for weeks, and now there's a dull ache in your upper right belly. You blame stress, poor sleep, maybe indigestion, but what if it's more? We often ignore these subtle signals, normalizing tiredness and random aches. But sometimes these are early warnings from your body about something serious. Could these be signs of fatty liver disease? Today we'll break down the red flags you shouldn't ignore. Let's talk about non-alcoholic fatty liver disease, or NAFLD, a condition affecting millions, often without them knowing. Fatigue is often the most common symptom people experience, yet it's also the most frequently ignored. We tend to brush it off as just a part of our busy lives, but it can be a significant indicator of underlying health issues. This isn't just being tired after a long day, it's a deep, persistent exhaustion that sleep simply doesn't fix. It's the kind of fatigue that lingers, impacting your ability to concentrate, enjoy your hobbies, and even perform everyday tasks. It's a constant drag on your overall well-being. Your liver is your body's unsung hero, acting as both a filtration system and a vital energy hub, working non-stop to keep you functioning optimally. It processes nutrients, filters toxins from your blood, and plays a crucial role in energy production. When fat builds up within the liver, a condition known as fatty liver, the liver gets inflamed, hindering its ability to effectively filter toxins and properly regulate energy levels. This inflammation can damage liver cells and impair its overall function. That means more toxins circulating in your bloodstream, leading to that frustrating brain fog, and significantly less energy available for everything else you need to do, from work and family to hobbies and self-care. Wild blood sugar swings, those highs and lows that leave you feeling jittery and then crashing, coupled with chronic inflammation throughout your body, leave you feeling utterly drained and depleted. This isn't just the result of stress or a few nights of poor sleep, it's your body's engine light flashing, signaling that something deeper is going on and needs attention. If you're feeling this persistent fatigue for weeks on end with no clear or obvious reason, your liver could very well be sending out an SOS, desperately trying to communicate that it needs help. Don't ignore it, listen to your body. Early action and intervention can significantly help you get your energy levels back on track and reclaim your overall health and vitality. Talk to your doctor and discuss your concerns, especially if this sounds familiar and you suspect your liver might be struggling. That dull ache, that persistent discomfort in your upper right abdomen, the kind that lingers that you can't quite shake off, it's easy to dismiss it, to write it off as nothing serious. But what if it's more than just a fleeting pain? It matters. Ignoring it could mean overlooking a developing issue. Fatty liver, a condition where excess fat accumulates in the liver, can cause the organ to swell and enlarge. This isn't just a minor inconvenience, it's a sign that something is amiss within your body. As the liver expands, it stretches its outer capsule, the protective layer surrounding it, triggering pain signals. This capsule is filled with nerve endings, making it sensitive to any changes in size or pressure. It's not a sharp, stabbing pain that demands immediate attention, but it's persistent, a dull, nagging ache that just won't seem to fade away. It often manifests as a sense of fullness or pressure in the upper right abdomen, a bloated, uncomfortable feeling that doesn't go away, even after rest. Many people dismiss it as simple heartburn, reaching for antacids in hopes of relief. Others might attribute it to a pulled muscle from exercise or overexertion, assuming it will heal on its own. But its persistence, the fact that it lingers day after day, is the crucial clue that something more could be happening beneath the surface. The liver itself doesn't have many pain receptors directly within its tissue. It's a relatively insensitive organ. The ache you feel comes primarily from the stretching of the capsule and the inflammation surrounding the liver, irritating nearby nerve endings. If you consistently notice this discomfort, especially after eating a heavy meal, consuming alcohol, or as the day wears on and you're feeling more fatigued, pay close attention to these patterns and listen to what your body is telling you. Track when it happens, what you were doing or eating beforehand, and how long the discomfort lasts. Share this information with your doctor during your next checkup. They can assess your symptoms and determine if further investigation is needed. Don't tough it out, hoping it will simply disappear on its own. This persistent ache is your body's way of sending you a signal, asking for help and attention. Early attention and diagnosis can make a big difference in managing liver health and preventing more serious complications down the road. Unexplained weight gain can be incredibly frustrating. You're eating well, exercising, and doing everything right, yet the scale refuses to cooperate. It's a common struggle, and often the reason goes deeper than just calories in versus calories out. This is especially true when the weight seems to accumulate primarily around your belly. While some fat distribution is normal, a disproportionate amount around your midsection can signal a problem beyond just aesthetics. This localized weight gain, particularly around your abdomen, can be a liver red flag, indicating that something isn't functioning as it should. The liver plays a crucial role in managing fat processing within your body. It's responsible for breaking down fats and distributing them for energy or storage. However, when the liver becomes overwhelmed by excess fat, it starts to store it within its own cells instead of efficiently burning it for fuel. This leads to a condition known as fatty liver. This fat accumulation contributes to insulin resistance, a condition where your cells become less responsive to insulin, requiring your body to produce even more. This excess insulin, in turn, causes even more fat storage, exacerbating the problem. The excess fat storage is often concentrated as visceral fat, which accumulates deep within the abdomen, surrounding your vital organs. This type of fat is particularly dangerous because it's metabolically active and releases harmful substances into your bloodstream. It's a vicious cycle, a self-perpetuating loop that's difficult to break. Fatty liver, more insulin, more belly fat. This isn't just about willpower or calories, it's not simply a matter of eating less and exercising more. It's a metabolic issue, a complex interplay of hormones, enzymes, and cellular processes that are out of balance. Stubborn belly fat may be a sign of internal chaos, a reflection of underlying metabolic dysfunction within your body. It's not just a cosmetic problem, it's a potential indicator of deeper health issues that need to be addressed. If your weight won't budge despite your best efforts with diet and exercise, and especially if you're noticing increased abdominal fat, it's time to consider your liver health as a potential contributing factor. Addressing the root cause of the problem, rather than just focusing on the symptoms, is key to achieving sustainable weight management and overall well-being. Jaundice, yellowing of the skin and eyes, is a loud alarm from your liver. It means your liver can't process bilirubin, a yellow pigment from breaking down red blood cells. When bilirubin builds up, it turns your skin and eyes yellow. This is a sign of advanced liver damage, not an early warning. Jaundice often comes with pale stools, dark urine, and intense itching. If you notice yellowing, seek medical help immediately. It means your liver is in serious trouble and needs urgent attention. Don't wait, this is a medical emergency. Dark urine brown, cola-colored or orange can signal liver trouble. Unlike dehydration, this color stays even when you're well hydrated. It happens when bilirubin backs up and your kidneys try to filter it out. If you see dark urine along with pale stools or jaundice, your liver is struggling. This isn't an early sign, it means significant liver impairment. Don't ignore persistent dark urine, get checked right away. Your urine color is a daily clue to your internal health. Listen to what your body is telling you. Imagine listening intently to your body's subtle warnings. Fatigue, that constant weariness, aches, those nagging pains, stubborn weight gain that just won't budge. One person did listen, got checked thoroughly, and caught fatty liver disease in its early stages. With simple, consistent changes, better wholesome food, significantly less sugar and more movement in their daily routine, they successfully reversed the liver damage. Their energy levels returned, pain gradually faded away, and stubborn belly fat visibly shrank. The liver is remarkably resilient, especially if you act early. Don't ignore those crucial warning signs. Talk openly with your doctor, get the appropriate tests done, and proactively take charge of your overall health. If this information was helpful, please like and subscribe, and stay tuned for even more valuable health tips.